heard the pandemic at this point being referred to as a pandemic of the unvaccinated. Why do you suppose we're seeing this surge?
Well, the way that this surge really started was that there was an uptick in our pediatric cases. So schools opened, and as we know, there have been some schools around the state that opened without mask policies in place, and so there was an uptick in cases in that 5 to 18-year-old age group. And what we saw, looking at the data with our partners at the University of Michigan School of Public Health, is that the cases in schools where there were no mask policies were actually higher and rose faster than those in schools with mask policies. But initially, this was a surge in that younger age group. And then, of course, there's always spillover into other age groups. And that's what we are seeing now. Part of the reason, I think, for the surge in this younger age group is that this was our unvaccinated age group. Until very recently, we didn't have a vaccine available for those under the age of 12. And so bringing back unvaccinated students, especially in settings where there weren't mask policies, led to outbreaks in those settings.
So, what do you think it takes to get this under control?
Well, one of the things that we have seen is that this surge, the cases didn't rise as rapidly as previous surges. This has been a slow and steady increase in cases. And the reason for that is because we have a lot of individuals here around the state who are vaccinated. When we look at those who are over the age of 16, we're right at around 70% in terms of our vaccination coverage, which is fantastic. But one of the things we're seeing is that our vaccination rates differ among different age groups. So we have phenomenal vaccine uptake in those over the age of 65, where vaccine uptake approaches around 85, 86%. And then it drops down across younger age groups. And when we look at our 12 to 15-year-old age group, vaccine uptake is only 42%. We now have a vaccine that's available for those between the ages of 5 and 11, and we're really hopeful that parents will get their children vaccinated. But until we see vaccine uptake increasing across all of those age groups, it's going to be really hard to control transmission.